right, those are cheers from the passengers on a plane when the attendants are announcing mid-flight that travelers can take their masks off. After nearly 2 years with a mask mandate, travelers no longer need to mask up on planes, trains, and buses. Of course, after this week's news, there's some who want to keep the masks on, including some in the medical community. We're going to take a closer look at the debate over who can make mask mandate decisions.
Just 2 days after some flyers removed their face masks mid-flight, a legal challenge from the Justice Department could potentially bring the federal mask mandate back.
We're all ready for it to be over, but we want to ensure that our public health experts are able to take steps if needed in the future.
As of Thursday, it remains up to passengers to decide whether to wear masks on public transportation, though the sudden rule change Monday led to confusion, with some cities like New York and Philadelphia still requiring masks on trains, buses, and in airports. In a statement, the CDC defended the mask mandate, saying at this time an order requiring masking in the indoor transportation corridor remains necessary for the public health. A Trump-appointed federal judge in Florida struck down the mandate Monday, saying the CDC exceeded its authority and didn't follow rulemaking procedures. And this comes at a time when COVID-19 cases are surging in parts of the country.
The problem with air travel is
CBS News contributor Dr. David Agus says that while airplanes have strong filtration systems, it may not be enough for high-risk travelers.
those people will have more of a difficulty going out in public with the potential of being exposed. They can get very ill.
Which is a very real concern for Brian Vastag of Hawaii. He traveled to Alaska for treatment for his autoimmune disorders.
I am constantly assessing my risk. I'm not going to know, is there somebody on the plane who's sick right now?
Now, as pandemic fatigue sets in for so many, appealing this case carries risks for the Biden administration. What's on the line? The future influence of the CDC and the federal government's ability to issue safety and health regulations like the mask mandate in the future. Errol Barnett, CBS News at Reagan National Airport.
Right now, we really don't know the timeline yet for the appeals process. Experts say the decision has more to do with legal precedent than medical guidance.
The real question here is, what does this mean for the CDC's power to reimpose a mask mandate? Say if we have another big surge next fall or winter, or say we have another pandemic.
The doctor says she expects future surges as new variants pop up, and that's why she supports leaving decisions like the federal mandate for travel up to the CDC.
Stripping ourselves of an essential tool in the toolbox is a really bad idea. I think we do need to have that option at our disposal if we do face another crisis.
Well, the rule might be gone for now. A bunch of people wonder, though, if they should keep masking up. Dr. Christopher Uhl from Atrium Health Wake Forest Baptist says there's two ways to look at it.
The second thing is that transportation, where we're all kind of sardines in an airplane or a bus or a train or a subway, is a place where people are closer together and viral transmission's more likely, and so masking is more important in those situations. But you know, the other thing is that we've entered into an era, and we're going to continue to travel down that road, where you can take personal responsibility for protecting yourself, and whatever anyone else wants to do, that's their issue, and they can do what they want to do.
He says people who want to feel more comfortable can keep wearing their mask, and it will offer some protection to them. Well, airlines and transit companies, they acted quickly after the judge ruled that they could remove those mandates. So I want you to take a look at all the places loosening restrictions. Yeah, basically it's like check, check, and check. Basically all of them. Here in North Carolina, all 3 major airports removed their mask requirement. The Greensboro Transit Authority dropped their mask mandate as well. Both Uber and Lyft removed their COVID restrictions earlier in the week. Well, not everyone hopped on board with the plan to drop the masks. Airports in cities like New York, Philadelphia, wearing masks on the actual plane still remains up to the airlines. But travelers need to wear them while going through security and at the gate. A lawyer says that falls in line with how Philly has treated COVID.
Philadelphia actually did away with the CDC guidelines as a standard, and they've invented their own guidelines.
Disease experts say the CDC's goal is to provide minimum guidelines. They say the agency tries to leave decisions up to local governments and businesses to meet whatever the community needs. Now, all the mask talk, of course, comes as we are starting to see an uptick in numbers locally. This graph right here shows the percent positive in Guilford County. The latest report shows more than 7% of tests coming back positive. That's just above the state's goal of 5%, and it falls in line with the trend that we've seen for about 2 weeks now. Now, this next chart shows hospitalizations in the county. They've fluctuated more recently. The latest report shows 19 people in the hospital. That remains much lower than the winter surge, of course. Well, Dr. Uhl says North Carolina has fared better than other parts of the country. Part of it comes from warmer weather and going outside more. Another part of it has to do with how many people got sick in the wintertime.
The Omicron surge that we had in January is largely one of the things that's helping protect our population right now, particularly the unvaccinated population.
The numbers are not as encouraging nationwide. Cases have gone up about 50% in the last 2 weeks. Fortunately, hospitalizations have held steady thus far. Some health experts worry this could be the start of something more serious coming again soon.
The biggest concern is what's going to happen in the coming months. What if we have a more dangerous variant that's deadly, that gets away from our vaccine-induced immunity?
Most medical experts project a bigger jump in cases, though, this fall and this winter. Now, the jump in cases has some wondering if they need a fourth dose. It is approved for some groups, but not for everyone. Dr. Anthony Fauci says the medical community needs more time to get data.
The effectiveness of the first booster dose, we know, wanes over time. And growing evidence indicates that a second COVID-19 dose can restore vaccine effectiveness for certain populations, and albeit the data now, at least for the short term, and we look forward to longer term data.
The CDC met yesterday to consider second boosters for more people. They haven't made a decision as of yet. Well, like we've seen all through the pandemic, this looks like just another example of a time where we need to let the process play itself out. There are the science aspects, of course. There's the court and the legal proceedings. It could take some time to get everything sorted out. You can count on us to keep you updated as it all unfolds. WFMY News 2 at 6 is next.